1 in 31 American children is autistic. Here's what that really means for families. Autism Spectrum Disorder is a lifelong brain-based developmental difference affecting social communication and behavior. Roughly 3.2% of 8-year-olds nationwide, about 1 in 31, have an autism diagnosis. Children of every race, income, and region are identified, though boys are diagnosed 3 to 4 times more often than girls. Think of autism as a spectrum, not a single profile. Some autistic children speak in full paragraphs. Others communicate with pictures, sign language, or speech-generating devices. Core features can include difficulty holding back-and-forth conversations. Limited eye contact or unusual gaze patterns often appear. Many autistic kids develop intense, specialized interests and prefer predictable routines. Repetitive actions such as hand flapping, rocking, or spinning objects may soothe or regulate them. Unique sensory responses are common. Certain sounds, lights, or fabrics can feel painfully intense. Spotting early signs matters. By 18 months, a child who rarely points, waves, or shows shared interest may need an evaluation. Few or no single words by age 2 is another red flag. Some toddlers appear not to respond when their name is called, even though their hearing is normal. Echolalia, repeating words or phrases right away or hours later, can be an early communication attempt. Limited babbling or using the same gesture for everything may signal delayed development. Strong resistance to routine changes, even a new route to daycare, can also be a clue. Sensory overload adds challenges. Bright supermarket lights or a sudden blender roar might trigger distress that feels like physical pain. Covering ears, avoiding eye contact, or seeking pressure from a hug are coping strategies, not defiance. Remember, autism is not a disease and does not need curing. It represents natural variation in how brains process information and experience the world. Scientists point to a complex mix of genetics and environment. There is no single cause. Extensive studies show no reliable link between vaccines and autism. Early evidence-based intervention changes outcomes. Speech therapy builds language and social skills. Occupational therapy teaches daily living tasks like brushing teeth or handwriting. Behavioral therapies can break tasks into manageable steps and reinforce progress. Many families use picture exchange systems so non-speaking children can request food, toys, or cuddles. Structured teaching and predictable schedules reduce anxiety and improve focus. Playground time, social skills groups, and interest-based clubs encourage friendships. Some autistic people thrive academically with analytical strengths, hyper-focus, and remarkable memory. Others excel creatively in art, music, or design. Many report a powerful sense of justice and honesty. Yet every autistic person faces unique challenges requiring individualized supports. Routines help. Morning checklists, visual calendars, and timers ease transitions. Sensory tools matter. Noise-reducing headphones, weighted blankets, or chewable jewelry can calm overload. Inclusive classrooms allow children to learn alongside peers while receiving accommodations. Simple changes, extra processing time, movement breaks, softer lighting, create dramatic success. Bullying and misunderstanding remain obstacles, so community awareness is crucial. Parents, caregivers, educators, and clinicians form the support team. Regular developmental checkups and early screening lead to timely services. Insurance laws and education policies now cover many therapies, but families may need to advocate assertively. Local support groups and online communities share strategies and hope. Adults on the spectrum increasingly mentor younger generations, proving that autism spans the entire lifespan. Employment programs teach interview skills and match autistic talents to supportive workplaces. Technology opens doors, voice-to-text apps, smart home devices, and online learning expand independence. The autism community reminds us that different ways of thinking enrich society. Our goal is acceptance, accommodation, and empowerment, not forced conformity. If this overview helped clarify the spectrum, remember there is always more to learn. Subscribe for clear autism guides delivered every week. Comment your biggest question below so we can answer it in an upcoming video.